Welcome to the Casual Conversation, Wellness, Healing, and Healthcare with Daenerys, a podcast about healthcare through the lenses of mental health, microaggressions, and systemic bias. So come in, grab a cup of tea, and let's have a conversation. Welcome back to the Casual Conversation, Wellness, Healing, and Healthcare with your host, Daenerys. And this is episode 4, guys. Can y'all believe that we are 4 episodes in already? That's even crazy to think about, that a whole month has passed. But I've been having fun with this, and I'm thankful for the support, the feedback, everything good that's going on with it. People are joining the conversation, they're joining the community, and everything is just coming together just how I envisioned it. But yeah, we're gonna keep rocking and rolling, and we're gonna keep this thing going with episode 4. And this episode is a fun one. That's all I'm gonna say about it. This one is just about how the H in hospital doesn't mean hotel. Okay, so we're gonna dive into topics talking about how hospitals enable patient entitlement, the obsession with patient satisfaction scores, and the unrealistic expectations placed on healthcare staff. And I think that a lot of us can agree, especially people that work in healthcare. Sometimes patients just come in feeling entitled and feeling like they're at the Ritz-Carlton or the Westin or the MGM Grand or the Four Seasons. And it's like, yo, you're here for help. You're here for healthcare. You're here for healing. We have to do what we have to do. And that may not always come with comfort being a priority. Some things are going to be uncomfortable during your visit, just because we have to make sure that you're safe and that you are getting better to go home. But enough about that. We're going to get into it. And so let's go ahead and get into the episode right now. All right, so in this episode, we're going to do things a little bit different. I have a collection of TikTok videos that I'm going to pair with each topic. I feel like it's going to add some comedy to the episodes, but also the TikTok videos are to really paint a picture of just how ridiculous this stuff has gotten. I love TikTok. It's so funny, and I hope that you guys enjoy how I'm doing this episode. We'll talk about, we'll watch the video first, and then we'll talk about it, and that's how we're going to do for the duration of the episode. So without further ado, we're going to talk about the rise of patient entitlement, and here's the video. Let's watch and listen together.
Listen up, I'm an ER nurse, and I have a bone to pick, because I don't understand rude patients. I don't understand when you come into the ER and you're screaming at me as a nurse. And I'm talking about patients that are totally with it. They know exactly what they're saying, and they're just rude AF. And what is the expectation here? Because how much power do you guys think we have as nurses? I feel like there is something not adding up here, because you guys think I have a lot of power, and I really don't. I follow orders. If the orders are not in, if the doctor has not seen you, I don't have anything. I can't. There's nothing I can do. I will try to advocate for you. If you tell me you're in pain, I will gladly let the doctor know, hey, this patient is in pain. This is what they're here for. Is there anything we can give? But 99% of the times, the doctors will need to see you first before they can assign any medications to you. So I don't know what you think I am capable of, but you screaming at me doesn't help. I don't know why you think I want to torture you as a nurse. I don't. I really don't. First of all, I'm not that mean. And second of all, I don't get paid enough. I really don't. So if I can give you what you need so you can be a happy, nice patient, I would give it to you. Promise. I promise. I just don't understand why you guys think as nurses, we don't really have that much power. We just have to follow orders. So I don't know why we're getting yelled at.
All right. I like that video. I think that was a good video to start us off with. And as an ER nurse, I can totally relate to that video. Patients think that we as nurses can just do whatever, whenever, and that's not really how it works. More times than not, you are going to have to see a doctor or a nurse practitioner or a PA first before we can give you any medications or do anything on you. Now, what I can say, and I also try to do this as my due diligence, is in most ERs, you have what's called nurse protocol orders. So for the most common chief complaints like chest pain, abdominal pain, urinary symptoms, respiratory symptoms, there is a curated order list of orders that we basically just click on whatever the most common or whatever you're presenting with that most goes with that chief complaint. And a lot of orders just pop up and we're able to, put them in for the doctors. And that way we can just draw basic labs. We can get you basic medications. The only thing that it doesn't include is pain medicine because that's, the doctors need to see you first. But like we can give nausea medication. We can give Tylenol, if you have a fever. So we can do some things. But more times than not, it is going to take a little bit of patience for you to see a doctor before we can give you any pain medicines and stuff like that. I do try to make you as comfortable as possible, like giving you blankets and making sure that you're okay. Of course, no food and water until you see a doctor. And not even just that. More times than not, you're not going to be able to get food or water until you have your lab results back and or your imaging. Because if it's something emergent, that you need to go to surgery for like that day, you can't go to surgery and be under anesthesia on a full stomach, because that can cause, aspiration, and that's basically where like you vomit into your lungs. And it's a whole nother, cascade of things, and it could be very dangerous. So more times than not, again, I try to do the best I can, but our hands are tied, and until you see a provider, there's not much that we can do. So I definitely agree with what she was saying, and it is kind of tough explaining those things over and over and over and over again to patients in a 12-hour shift. But I do understand that everybody doesn't know, and some people, you just have to remind them gently. So yeah, I think that was a good one to start us off with. So now we're gonna get into the second video, and this one I feel like is funny. So I think you're gonna enjoy this one. So let's go ahead and watch this one and listen to it together.
Can someone please explain to me why hospitals are now wanting us to call patients customers? Okay, we went from patients to clients to patients to customers. Why would you want us to call them customers? Do you think that makes them feel better? They are patients. What is wrong with that? Please enlighten me. One of my friends is a new grad, and she sent me a text saying they're teaching us to call the patients customers. Is it because I keep saying this is not a hotel, it's a hospital? Am I not allowed to say that anymore? Because now they really are customers. So is it really a hotel now? It really is a hotel now. The customer knows best. Is that what we're doing in this situation as well? Is that what we're doing? What is happening? They claim it makes them feel less of a person and more like someone sick in a bed when we call them patients. Isn't that what's happening? And if they're being dead serious, I'm gonna start carrying this around. Tip me then. Give me the gifts. If you give me more than a $20 gift card, I'm putting it in my pocket and I'm leaving if we're calling them customers.
That was a funny video. I love that content creator. She's pretty funny, and I think that she's just super animated. So I feel like that was a good comic relief video. But she's right though. Healthcare has shifted from patient-centered care to customer service care. And as far as calling patients customers or clients, like, that's a real thing. Like, I'm a teacher and I teach part-time nursing students, and in their textbooks, in their literature books, they're calling the patients clients. And so they've already started to train up the next generation of healthcare providers to start calling patients clients. And I always found that to be kind of peculiar, because what is that for? You know, and I feel like it just creates a false sense of entitlement and a false sense of like, do what I say, in a way. Like, I know what's best for me, but you don't. So I always just thought that was interesting, but that's been like that for a few years now, calling patients, clients or customers. But like, to bounce off of that, like, time is money. I feel like people think time is money, which it is essentially. But like with all this new technology like AI and things like that, hospitals and companies and everybody has found ways to streamline productivity for workers and make things easier and add more to like the workers' load. And I feel like when people come into the hospital, they're expecting fast food service and they want to get in and get out. And while for some people that is appropriate, that is okay. Like, that's fine. But for other people, it's just not. Like, with people with more complex illnesses or diseases and chronic illnesses, like, you're not going to get in and get out that quick. So just have some patience. But I did want to touch on this too. I feel like COVID really changed healthcare. I think because we were all quarantined and we were on our phones and, just scrolling on TikTok, Instagram, and things like that. We had more time to really learn new information. And I love that we are a more informed society because of that. And I also like it because we're able to advocate for ourselves better. And while that's good, I love that because it makes for a collaborative effort as far as your healthcare. Meaning, if the doctors, run certain tests or run certain labs and images and all that, if they didn't do something that you feel is important to run, you're able to speak to that. Like, hey, so in my research, I, seen that, typically you can run this lab and do this imaging and, just be more collaborative. I do like that. But I think that it's also caused a false perception of, I know what's wrong with me and what I need and give it to me. Basically, so like, for example, if you Google your symptoms and Google is telling you that you have a sinus infection, right? And that you need antibiotics as your treatment. And then you come in and you're like, hey, I think I have a sinus infection, and you're just so bent on, I need antibiotics, and that's what you keep asking for. They do the test and all that, but you really have the flu, right? A flu is a viral illness. So antibiotics do not treat and will not cure you of a viral illness. And so with your diagnosis being the flu, it's like, okay, that just takes for some education. Those type of patients are typically easy to work with because you can just educate them and they're, better, they're fine, they're satisfied. But then you got the patients that are just super entitled and just have all these demands, like, food. Like, food is a big thing. As soon as you come to the hospital, and these always kind of like tickle me a little bit. You come in for abdominal pain. You're saying you've been throwing up for, 2 days, right? And then as soon as you get to the back, you're asking for food. You're asking for sandwiches. You're asking for drink. And it's like, you're going to throw it back up. Or, we just don't know what's going on with you. So we have to, once again, like, run the test and, see, like, what's going on before we can get you food. Also, too, if you are NPO, meaning nothing by mouth, there's a reason for that, okay? Maybe you have to go for a procedure in the morning or, I don't know. There are 1,000,001 reasons why a doctor would withhold food and drink from you for a particular time. And patients are sometimes don't understand that. They're calling their family members to bring them food. You know, they're still demanding food, demanding drink. And it's like, you know, it's for your safety. That's really why we're not feeding you. And also family members, if you are going to bring somebody that's in the hospital food, please check with your nurse or your doctor before doing that. It's very, very important. But yeah, so just demanding like food, and demanding like pillows and, you know, I don't want to go to this room or I don't like this. And, you know, it's just, and I get it. I'm not saying that you cannot be comfortable at all. But what I'm saying is the urgency that you expect, like, behind it. So, like, not understanding that the nurses and the doctors have other people to also attend to, and some people who have more emergent needs, you know what I'm saying? So for example, right, if I was going to get a patient a cup of ice and a blanket, and I get stopped because I have somebody who's having a heart attack or something that's more, you know, just more emergent coming into my other patient room, I got to put that cup down and go see about that patient, you know? And that also pulls resources so that, you know, that type of emergency also pulls a lot of the staff, you know, to come together to, stabilize that patient. So, you know, I come back with the cup and with the blanket and, you know, it's been like an hour or however long it took, and the patient's pissed, and it's just like, you know, I'm sorry, but I had to go, you know, deal with something that was more emergent. So I would just say, like, really just have grace with your healthcare providers and nurses, because I try to tell patients this when they're really being needy and on the call light and stuff like that, is while your comfort is very important, it's important to me and it's important to you, it's not a priority. Everything in the hospital goes by emergent priority, or I guess medical prioritization. So whoever is the sickest, that's who is going to get, you know, the nurses and the doctor's time in that moment, you know? So even though I know it's annoying to wait an hour or wait 30 minutes for a blanket or a cup of ice or something to drink, it's just like, it's not going to hurt you. It's not going to harm you. Like, you know, and being rude and being mean because of that, it's not going to help your situation. And I think that right now I'm talking to the general public when I say this, like, please just have more grace with your healthcare workers. Please have more grace with the people that's taking care of you. We are doing the best that we can do. We are tight right now. You know, we're under pressure right now. And, you know, you complaining about something as simple as a cup of ice is not making it any better. That's only adding stress to your nurses and to your doctors' workload. So I just had to, like, really speak about that for sure. Like, that's really a problem. And also too, like, if you have family that's in the room that can help with some of these things, please, like, help us help you. So if your family member can change the TV channel for you, have them do that. If your family member can help you to get comfortable in the bed, allow them to do that for you. And I hate that I even have to say that, but there are family members who refuse to do anything in the hospital for their family. Like, it's almost like, oh, that's not my job. And it's like, we're all here to collaborate together, and to help each other out. So please just help us help you. Because again, we're only doing the best we can do. All right. So the next topic is the patient satisfaction scores. And patient satisfaction scores are, real quick, once you leave the hospital, when you get discharged from the ER or from the floor, you'll get either a letter in the mail or an email asking you to fill out this survey about your experience. And basically, hospitals use those to figure out what's working, what's not working, what they need to improve on. But do they really use those for that? We're going to get into it. All right, let's go ahead and watch the first TikTok video about patient satisfaction scores, and then we'll, talk about it afterwards. Here we go.
I always wonder if there's ever going to come a time where we finally realize that patient satisfaction scores are basically one of the many things that is causing the healthcare world to go downhill. Like, they're not even inclusive. They're not diverse at all. Most of the people that fill them out are only patients that go home, number one. And we know that most of patients, especially from hospital settings, a lot of them don't go home. It requires the person to get something in the mail, understand that in the mail, be able to fill that out, and be able to send it back. Or, even worse, it requires them to be able to do something completely online. So think about your amazing grandmother with dementia. Had the best care ever, best everything, ended up going home. She gets her mail, a couple people help her throughout the week. They do as much as they can for her, but they can't get to everything. So of course the survey comes in the mail. You think they're going to fill that out? Probably not. She had great care, but no one's going to fill it out. But you know who's always going to fill it out? The angry patient. No matter what, 100%, they're always going to fill it out. So why are we pretending that these are accurate ever in any way, shape, or form? They're not. They're not at all. And pretty soon, they're trying to get payments to everything based on satisfaction scores. It's going to be crazy, and it's going to be awful. Absolutely awful.
That was a good one. And I definitely agree. And the last point when she was saying how the hospitals are or will soon be getting money off of scores, like based off of scores, that's already happening. Hospitals get funding and get money from the government based off of a certain score from the patient surveys, which goes into like capitalism, which is America's problem right now. Like, America is really ran off capitalism, and it's really sad how this type of stuff doesn't benefit anybody. The nurses, the doctors, the patients. It only benefits the hospitals and the CEOs and like the top dogs. You know what I'm saying? So that's just more money in their pocket, because we're not seeing that money. They're not putting that money into actually improving. You know what I'm saying? But the problem with the patient satisfaction scores is a few things. And the first one is high satisfaction doesn't always mean good medical outcomes. Just like, I have an example. So an example of that would be like if a patient needed blood pressure medicine, right? And that's pretty common. We all know somebody or have heard of that, more than likely than not. And a patient is like, oh, well, I only want this one versus that one, or something of the sort, from researching and maybe you heard something through the grapevine that your family member took the same medicine and, it caused all these complications and things like that, which is valid. However, right now, for your type of blood pressure, this is the best treatment for it, right? And you're just like, no. And so the doctor gives you what you want, and it's like, it doesn't help you in the long run. Like, you're gonna more than likely have complications from that. But you see what I'm saying? Like, it's not really going to be effective. So you're going to continue to have blood pressure problems, just based off of not really having the right medication, And I see that a lot, actually. Blood pressure is something that is really, really hard to manage as is. So it's very important to like really, really take that serious. Blood pressure can cause strokes, can cause heart attacks. Like, it's not something to play with. And they call it the silent killer for a reason, because you really don't have too many symptoms. You kind of just are just flowing with life, and your blood pressure be high. And more times than not, you're not gonna know. unless you regularly get that checked. Another example is like nurses and doctors being penalized for saying no to a patient demands. And like she said in the video, angry patients will always fill out that survey. It don't matter. It don't matter. It don't matter. They're going to fill that survey out. Okay. Probably while they even there. You know what I mean? And I actually have a story about this. That's kind of similar to this. So this was in 2020. And I was in the ER, working in the ER at night. And this wasn't even my patient, actually. I was taking over for another nurse for lunch. So I was covering her patients. And to my new nurses and to my nurses in general, this is why documentation is important, okay? So when I took on the patient, and I covered her lunch, I documented, covering primary nurse during lunch break, all this and all that. I got report from primary nurse. Something like that I said. And yeah, so it was a lady. She was walking her dog, maybe? Something with her dog. I can't really remember like the specifics of how it happened. She was walking her dog or something like that, and the dog either snatched her or she tripped over the dog. And she had lacerations on her forehead and on her nose. And so with lacerations, that's an easy fix. You stitch them up, you're gone, and it just heals up. And so I remember the patient like refused to get stitches. And so I go in there with the physician's assistant, and he's just like, why don't you want stitches? You need stitches, we need to stitch this up. And if you don't know, like, stitches have to be done within a certain amount of time to prevent infection and to get the best optimal healing. And so she was just like, no. And so the ER doctor came in and was like, what's going on? Like, why don't you want stitches? And she's like, well, I heard from a friend that ER doctors and stuff are bad with stitching, and I don't want to mess my face up. And basically she was demanding a plastic surgeon. And real quick, in the ER, we don't just have, or in the hospitals in general, like, we don't just have those specialty doctors just sitting like upstairs, like they're on call. So any type of special doctor, like a OBGYN, a plastic surgeon, a orthopedic surgeon, or whoever, right? The ER doctors have to consult them, meaning they have to call them, tell them about you, tell them about your case, and then from then on, that doctor pretty much tells the ER doctor what to do. So if it's something to where, okay, the specialist can see that patient in the clinic, outpatient, like the next day or 2 days from, then that's what will happen. Or the specialist will say, hey, just admit the patient and I'll, follow their treatment, or, whatever the case may be. Or if it's emergent enough, they'll actually come to the hospital, to the ER, like right then and there, and see the patient. So it just depends. However, in her case, she did not need a plastic surgeon consult at all. Like, that was not a medical reason to consult a plastic surgeon. And so she was super bent about this, yelling, screaming. I mean, she was cutting up about it. And the ER doctor was like, look, I will take my time. Like, he was just trying to reassure her, just all these things, to convince her that, this is very, very important that we go ahead and get this done. But also, too, that no matter who does your stitches, you're still going to have a little bit of like scarring and things like that. But over time, it will heal and it will get better. And so she was just like, nah. By that point, the primary nurse had came back from lunch, and I never really got to see the outcome of that. However, I'm assuming that she did get the stitches, because months later, I'm talking about months later, I get an email from HR and the legal team from that specific hospital who I was working for during that time. And basically it was a deposition email, and they were calling me into this Zoom meeting. So it was me, the primary nurse, the doctor, the PA, anybody whose name was on that patient's chart got that email and was on that Zoom call. Okay, so you got HR in there, you got the legal team, like the lawyers for the hospital. It was a big thing. Okay, I'm nervous, I'm shaking, I'm like, what is going on? And again, this is another point that I want to make of why it isn't so important, nurses, to document everything, because we're seeing so many patients a day, a week, a month. Like, you're not going to be able to really recall a lot of situations, especially if, you know, you're called into a deposition years later. You're not going to remember what happened on, you know, February, whatever. You're not going to, no, that's not realistic. So I got the deposition email. I go to the meeting, and I just remember them asking me so they told us about the patient. And I remember when it was my turn, they had asked me, hey, you know, what do you remember about this patient? So basically they were collecting data and getting everybody's story, because she went to a lawyer and she was trying to sue them, basically, is what was going on. And so I remember asking them, okay, well, what did I document? Like, you know, where was my name in the chart, basically? And they said that, okay, we see that you documented that you took over care for this patient while the primary nurse was in lunch. You gave a couple medicines, and then you charted that, you know, the primary nurse, like you gave report back to the primary nurse. And I'm like, okay. So luckily I have remembered the lady, because she was just so cutting up. Like, that's something that, like, you know, you're going to remember, almost like a core memory. And, yeah, so I said, well, yeah, that's pretty much it. You know, I just remember, you know, her doing X, Y, and Z. You know, she's, you know, was super, she just didn't want no ER doctor, a PA, nurse practitioner to touch her. She, like, wanted a plastic surgeon. And like the doctors and the PA did educate the patient and things like that, but, you know, I didn't see anything past, you know, just a conversation and education, unfortunately. But everybody's story is, you know, pretty much the same. And again, I don't even know what happened after that deposition. It kind of just went away, but yeah, that was just another example of just like how even that can go to the extreme, like of patients just not getting what they want. And then lastly, another problem with the satisfaction scores is hospitals using these scores for marketing and funding rather than true improvement. Like I said earlier, they're not using this money for supplies. They're not using this money to make sure that we have some adequate staff. They're not using the money to make sure that we have the resources that we need in order to have a good workflow, to have a good shift, to provide the patients, you know, like the best experience. Because if we're having to work around things or you know, we don't have certain things, like, it's really hard to do our jobs, one, efficiently, and also in a more timely manner. It just creates a lot of loopholes for issues, which is, you know, something that has become the new normal, but it's not right. You know, just because something is normal doesn't mean that it's right. So that's another example of it. They are using it for commercials. Like, if you've noticed, if you've seen a commercial from a hospital, more times than not, they will mention, you know, rated 87% patient satisfaction. You know, we're a magnet hospital. You know, we've been rated top whatever for, you know, US ranked hospitals. Like, they're using that for marketing. They're not using that for real change. It's sad, but it's true. So with that being said, we're going to move on. Now we're going to watch a video about basically when the customer is right, goes wrong. This video is very, very enlightening. So yeah, we're going to watch it, listen to it, and discuss it afterwards. Here we go.
Hi, nurses. I want to take a moment today to respond to a comment that I got on one of my posts about nursing shifting to a customer service-driven profession. I agree with the comment. I think we are shifting or have shifted to a customer service driven profession, but I don't think we should have. There's a lot of nurses that speak up and come forward and talk about how customer satisfaction, patient satisfaction scores should not be driving our behavior and should not be driving the decisions that we're making within the profession and on a daily basis. And I tend to agree with that. We have shifted from a profession where doctors and nurses were really respected and where there was a level of expectation that they were the individuals with expertise. And most of the time, in good and bad situations, you followed the nurses and the doctors and their care plans without question. I do think that it's a great thing that we are now an informed society and that we can now research and advocate and have a level of knowledge as far as what's going on with our bodies, our families, and our treatment plans. However, WebMD is not the answer. Google's not the answer. We are living in a world where patients are coming in with this expectation that instead of listening to us and complying with their treatment plans and doing what we recommend, that they're coming in expected to be treated a certain way, almost as if they were in a department store or a hotel. And that's just not what we're about. We want to help you. We want to empathize with you. We want to heal you. But there are certain things that you just don't get, right? So even me, I can't go out there and tell an engineer how to do their job because you just don't know what you don't know. I had a situation where I was assisting with a delivery and we had a shoulder dystocia, which is, for those of you out there not in OB, where infants coming out, mom's pelvis was rather small, baby's head came out, got stuck at the neck, and it was an emergent situation. We had really not even minutes to make some snap decisions to save that baby's life and to prevent mom from going through something that was even more traumatic than what she was already experiencing. So we did what any good nurse would do. And I stood on a stool, and between me and the physician, we gave suprapubic pressure. We got the shoulders underneath the mom's pelvic bone. We delivered the infant. Mom did have a little bit of trauma, but mom didn't have to go through a surgery that was unnecessary, and baby didn't die, right? Baby did experience broken clavicles bilaterally. Later, the hospital was sued. And as a nurse, I was just devastated. I wanted to say, how about thank you? And how about you saved my baby's life, but you don't know what you don't know, right? So should we be going into rooms and having a level of empathy and treating the entire patient and family, mind, body, and soul as caring providers? Absolutely we should. We should be doing the best we can in all situations. But I shouldn't have to apologize if they're not happy with something we're doing, or I can't provide them a certain treatment that is contraindicated or that we don't agree with. And I think nurses sometimes are expected to be the ones who go in the room and apologize and make sure that we get those rankings on our patient satisfaction scores. And I don't know that that's the answer. I miss the culture where there was a certain level of expectation as far as the nurse-patient relationship. In today's world, when we're looking at all of the abuse and the violence that's taking place against nurses and healthcare providers, we've lost that level of respect, not only from patients, but from maybe our peers, administrators, certain people in the healthcare arena. And it's time to stand up and take that back. It's time to look at quality of care, evidence-based practice. What is best for that treatment plan? And it's time to move away from basing funding and decisions on patient satisfaction scores. Just a few thoughts for today, just my daily ramblings, and let me know what you think and if you've ever experienced something that affected your care because you were leaning more towards patient satisfaction rather than evidence-based care.
Man, that was a good video. That was a good video. And it was just, and it was similar to what I just spoke about the lady not wanting stitches and everything. So the video we just watched was basically like, you still got sued for doing what was right. You still got sued for doing what was best in an emergent situation. And it's unfortunate that the baby broke, but they're both their clavicles, which your clavicle is just your collarbone. But if we're being honest, like, shoulder dystocia has a lot more long-term complications, than broken clavicles. Like, I feel like in that was the best outcome if something had to happen, you know? We always strive for nothing to happen, right? But if something had to just happen, you know, from that emergency, you know, again, broken bones was the best thing. And I know it's not, of course you don't want your baby to have broken bones, like, you know what I'm saying? And I can see how that parent would be upset, would be, you know, mad, you know, just outraged. I can understand that. But, you know, with the education and everything, like, if it, you know, with the provider just having that talk with them and explaining to them, you know, just as I just said, that this was the best outcome for what was going on, you know, I'm sorry that this happened, you know, and just apologizing for it, you know, of course, being empathetic about it. But it's also frustrating too with that when the administration does not have your back. So when she, you know, wanted to sue, just based on the emergency, what happened, and them doing the proper thing to do and that type of emergency, it's like, I'm sorry, ma'am, you know, there's nothing that we can really do, you know, like, that's, and not to where she can't sue, but at least like educating her from a higher up standpoint, because stuff like that, just when they don't have your back, it makes you feel like you are defeated, and it just adds to burnout, because at that point, for them not having your back, even in an emergent situation, it just feel like we're just providing service and not care. Like, okay, you know, and it just kind of make you feel like, you know, what's it all for? But, you know, we still stand strong. Things happen. You can't please everybody. But, you know, even when you're thinking about it in that way and it's still not enough, again, it feels very defeating. And that's, you know, and that is what it is. But let's finally move on to the solutions. How do we fix it? We've talked about the problems. We talked about how they, you know, happen and occur. But how can we solve this thing, man? How can we fix it? So, of course, I got a TikTok video for that. So we're going to watch that, and then we're going to talk about it.
You need staff satisfaction in order to obtain patient satisfaction. Let's talk about it. So I recently caved in and I started watching the show called The Pit. If you work in nursing or if you work in the emergency department, you really need to watch this show. So, spoiler alert before I keep talking. Up until this last episode that just aired, I really didn't like this lady, Gloria, who is the hospital administrator, right? So there's this specific episode where the charge nurse gets punched in the face by a patient, and Gloria comes down to the unit asking Robbie whether or not she filled out an incident report, and Robbie replies saying, you know, that wasn't my worry, I sent her straight to CT, making sure that, you know, she's okay. Everybody's worried for her. And then they just get into it, and Robbie basically says, like, hey, this wouldn't have happened if you would have been more focused on implementing safety measures, like getting more staff and getting more security to be on the unit, for everybody to be safe and feel safe. So then Gloria turns around to the nurses, who are upset clearly and with good reason, and says that the staff at the hospital are like a family. And we've heard that before. How many times? And I just thought that was so funny and like relatable because of the amount of times that we've heard that, right? So then the nurses start clapping back at Gloria, saying, do you not remember what the last nursing strike was like? It was a mess. Or do you think this is something our union needs to be made aware of? And the whole time, I was snapping my fingers. You bet I was. And I want to go back to my point where I say that you need staff satisfaction before you can get patient satisfaction, and so this show does a really good job at like shining a light at what nursing is like right now, specifically the emergency department, because I think that that's one of the main units that gets really low patient satisfactions. But those are things that we can't control, like how fast we see a patient, how fast we treat a patient, the amount of time that we can be in a specific patient's room. And all those things that equate to good patient satisfaction are not going to happen, unfortunately, until we have an environment that is safe, that is well compensated, respected, and well taken care of. I love nursing and I love what I do. And I think that every single person that works in this profession agrees with me. But I think that when management realizes that there is more to this issue, that is the day that we're going to be able to get good patient satisfaction scores.
And that's just that, guys. That's just that. You're not going to have patient satisfaction until you have employee staff satisfaction. That's just it. So some other ways that hospitals can fix it is we need to just go back and redefine and go back to just patient-centered care, which just means health outcomes and not comfort ratings, like really getting back to what's best for the patient. No matter how uncomfortable it is, it's just best for you. Protecting nurses and doctors from retaliation for prioritizing real care and customer service. Like, you know, the administration just having our backs, because we are allowed to say no. The healthcare professionals are allowed to say no for the betterment of the patient. And then also too, just reinforcing that excuse me, y'all, reinforcing to the public that hospitals are for medical treatment and not a luxury stay. So real quick, I'm going to put y'all on game. You're not going to get sleep in the hospital. You're going to have to be on monitoring more times than not. So there's going to be beeping. You are going to have to get your vital signs taken every couple of hours. So you're going to get woken up for that. You're going to have to get your blood drawn multiple times, because we want to make sure that you are improving and not declining. So you're going to get poked a million times, right? But this is all to keep you alive. This is all to heal you. This is all for you to get better and go home. And I know that it's frustrating and annoying, and it can even be uncomfortable because of the wires and cables and things attached to you. But this is important for your healing. This is important for your care. Okay? So let's work together, man. Patients deserve quality care, and healthcare workers deserve respect and support. I do want to encourage you to advocate for a healthier balance in healthcare. So, like, if you don't understand something, speak up. But let's give each other grace, because we're all just doing the best that we can do. You know what I'm saying? So, thank y'all for sitting with me, rocking with me. This was a good episode. I enjoyed myself. I do want to invite you to share your thoughts and your experiences as a patient and even as a healthcare provider in the comments. Like, how do you feel about this? Like, talk to me. You know, like, do you feel like hospitals should go back to patient-centered care, or should it be customer service? Like, should it be like the customer's always right type of thing? Like, drop your thoughts in the comments. Let's chat. Let's have a conversation. And I want to make a quick announcement. Even though I am so grateful that you guys have been rocking with me and listening to me be solo for the last 4 episodes, I do have an exciting announcement. Next episode, we're going to feature our first guest, and I'm excited about this one because it's going to be a conversation from a patient's perspective. And I think that it's going to be very enlightening, and it's going to be very dope. And I think it's going to change up the dynamic of this space, because now we can, like, I have somebody to bounce off of, and we can like really get into some conversations. You know what I'm saying? So I'm excited about that one. But as always, please join the community. Subscribe, share, tell a friend to tell a friend to tell a friend to join the conversation. But I'll see you on the next one. Until then, be safe. Peace.